Thanks, Bruce. Now, cold and flu season's bad enough, but add children into the mix and it's a nightmare. Generally, parents have relied on the good old cough medicine to help relieve the symptoms and give everyone a good night's sleep. But soon, as Sarah Davies reports, it won't be so easy to get your hands on some of your favourite brands.
The change of season has already taken its toll on 12-month-old Gabriella.
Oh, generally she's just irritable and I can sense that something's obviously wrong, and I try to alleviate her symptoms and make her as comfortable as possible.
Along with plenty of fluids, Mum Loretta relied on an over-the-counter cough medicine.
It's usually worked quite well, actually. I tend to only use it once or twice, just when it's quite severe at the early stages of the cold, when she's really suffering from a lot of congestion.
But the humble cough mixture is about to become a lot less accessible. The Therapeutic Goods Administration has ruled that come September, certain types of cough syrups for children under 2 years of age will only be available with a prescription.
We're not saying that all cough and cold medicines are bad. We're certainly not saying that they shouldn't be used, but there is a group of drugs that are of concern, particularly in children under 2.
The particular types of drugs that have prompted the changes are called sedating antihistamines.
For children under 2, these drugs are meant to be sedating, but often you'll find the reverse. So children can become quite hyped up or agitated. They can even experience hallucinations.
Terry White pharmacist Aaron D'Souza says there's a lack of evidence to prove that these medications actually work in young children and that the risks outweigh the benefits. So of all the cough mixture brands on the market, how many will be impacted?
The two main brands that are going to be affected are Demozen and Dimetapp, but of course there are the chemist brands, which are numerous.
I've heard about the prescription issue around cough medicines. I've got a couple with me. I was wondering if you could tell me if these are on the list.
Sure. Unfortunately, they are on the list, at the moment.
Our pharmacist has advised Loretta to stop using them until she has consulted her GP. In the meantime, he recommends using more traditional methods to treat the symptoms of a cold or flu.
There are other options such as the Fess Little Noses for unblocking a nose of a night time. Who could go past some Vicks Vaporub, of course, old standard.
Dr Jeanette Randall from the National Prescribing Service says the move comes in line with international standards already in place in the UK and the States. She says we'll also see better labelling on these types of medication.
You can see that this one actually already complies with the TGA requirements, and it clearly identifies that this medication should not be used in children under 2.
So when is it necessary to see a GP when your child has a cough?
Certainly if the cough is severe, so if it's very distressing for the child, if they're having any trouble breathing, if they have any other symptoms like a wheeze.
Loretta is happy to comply with the new ruling, but would be concerned about trying to find a doctor at short notice.
Well, obviously, if you're away on holidays and that type of situation does occur, it's a hassle because you don't have your normal GP on standby to call, and you have to find a doctor and then get in for an appointment, and then there's the cost associated with it as well.
Making sure we don't over-medicate our kids. Sarah Davies with that story.